I'm assuming you can see that it's recording, can't you?
Yes.
Okay.
That's the other thing. Each individual ought to be able to record the meeting if they want to, correct? That's the other thing we need to.
Yep. Yeah, I need to talk to him about that, and then the availability of the video, right? How we're gonna address that. And I don't care to hit on that if you want me to. Whenever you get
I'll mention it. If I get it wrong, you can do whatever.
Okay.
All right. Let's call meeting to order. Roll call. I think Karen's muted.
I got her now. Hang on.
Mark Bowers is muted, according to mine.
East Ward Alderman Rob Foster.
Here.
East Ward Alderman Mark Bowers.
Here.
Mayor Robert Williams.
Here.
West Ward Alderman Vicki Montgomery.
Here.
West Ward Alderman Stacy Lee.
Here.
Okay. Please stand for a moment of silent prayer reflection, followed by the Pledge of Allegiance. I pledge allegiance to the flag of the States of America
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, I want to welcome everybody to our first full video conferencing meeting, and I want you to know that we have coordinated with our city attorney in understanding what allows us to and how to conduct this meeting. I have a statement I want to read here at the beginning of the meeting, so if you'll just bear with me here. Missouri law allows the city to conduct a Board of Alderman meeting via video conference in the event of an emergency. Because of the COVID-19 outbreak, the Board of Alderman meeting scheduled for Thursday, April 9, 2020 will be held virtually using Zoom, a conference service, rather than having elected officials and staff physically meet. So with Zoom, the public can listen in on the meeting live with any type of phone or computer device. Our hope is to resume meeting together in person at some point in the near future, but for the time being, we as a city want to protect everyone from contracting this virus and believe that virtual meetings are the appropriate measure to keep conducting city business at this time. And so with that, there's a couple things that I want to go over just so that we're all in sync on how to move forward on the video conference meeting. I don't know if you have done these types of meetings in the past or not with your business or anything else, but one of the things is that you may notice sometimes there's a little bit of a lag in the audio between all the different people that are here. And so in a situation where we are asking for a vote, I will call both the yays and the nays. And I will ask you, if you are a yay, when I call the yays, for you to physically and visibly raise your hand so that it can be seen. Okay? So don't just respond audibly, but respond as a board member. The other thing is I want to let anybody know who's plugged in or who plugs into this meeting that this meeting is being recorded by the city. And access to that recording, anybody who needs to have a copy of it can get a copy of it from the city. We have the ability to put it on a thumb drive, and I'm not sure what the cost of those thumb drives are. We may pass that along, but we would make it available to anybody who wants it. If we have any issues in that process, then we could always also arrange to show the video at City Hall and at some point in time, and a person can watch it there. Although right now during this time that we're in, we would probably schedule that at a later time. The other thing I want to let you know is that you have the ability on Zoom. You may notice if you bring up your bar that you have by moving your cursor, that there is a record button down on that bar, and you have the ability to record the meeting yourself if you would like to do so. Are there any questions? Anybody have any questions on what we need to do or where we're at here using Zoom? Okay, then with that, we're going to go ahead and move forward with the meeting. We do have the minutes for March 12th, March 17th, and March 25th. Is there anybody that was not here during one of those meetings on the board? That being the case, and if there's any suggestions for changes or a motion to approve.
I move to approve.
Second.
All right, motion and a second. Did you get both of those, Karen? Okay. And unless there's any additional discussion, all in favor, yay, say yay. Raise your, by the phone.
Yay.
Aye.
All right. That's all four. So expenditures the same. Are there any questions on the expenditures or a motion to approve?
It looks to me like, as usual, all the sort of exceptional expenses are listed on the memorandum. Were any of those outside of what was budgeted or outside of contract?
No, I've got Monica unmuted on here too, but no.
I can see her shaking your head no, so okay.
No.
Okay. Yeah, move to approve those expenditures.
Second.
Have a motion and a second. Did you get that, Karen? All right, all in favor, raise your hand for yay.
Yay.
All right, that's all four. All right, so we, just to also mention one other thing as we're getting ready to go into this update on the COVID-19 with Michael. You might go ahead and get him unmuted here, Sam, is this meeting, we've intentionally, if there's something that had to be on here, we certainly would take care of it, but we've tried to keep it so that we're not taking care of business with anything with the weight of a bond issue. Those types of things we would certainly want to be in a boardroom dealing with. And so the things we're dealing with tonight are mostly going to be updates that we need to do, and then getting the routine business of the city taken care of, like the expenditures. We will have one bill on, because of a time sensitive thing of needing to open or talk about the opening of the pool. So, which will be the last thing on the agenda. Right now we have an update on COVID-19. Michael, I think, had sent out some information earlier. You said, Sam, that got out to the board.
It did. Yeah, like I said, he gets his most recent information. I think he got it at 2:00 today, and so we've sent it on over to you, but I'll let him go through.
Sure. But let's let Michael go ahead and give us an update on where we're at with COVID-19, and also part of that discussion is where we're at with the orders that the state, county, and city have put out for stay-at-home orders. So Michael, go ahead.
Okay. Well, I did get that sent out. I'll kind of go over the highlights if that's acceptable. So according to CDC, all 50 states have now reported COVID-19 in their states. 395,011 cases currently in the U.S., with a total of 12,750 deaths so far. Currently, Missouri Department of Health and Senior Services is reporting 3,539 cases in Missouri, and that was as of 2 o'clock today, with 77 deaths reported so far. And I think we've actually had another since 2 o'clock, I believe. I'm catching word of that, but I haven't confirmed it. The World Health Organization is reporting 1,353,361 cases worldwide, with 79,235 deaths. Webster County, we had 3. Currently, we have 2 cases. One recovered and is doing well. Actually back to work, I believe. And we've had no deaths in the county, thankfully. On the report, I did list all the counties and the totals. I don't know if everybody got a chance to see that. Kind of what I highlighted on my page is the counties adjoining us. So just kind of going alphabetically. Christian County has 17 cases. Dallas County has 2. Greene County has 72 cases as of today. Webster County had 3, now we have 2. And then Wright County has 7. All said and told, there's 86 counties plus St. Louis and Kansas City on that sheet that are reporting cases.
Well,
You'll notice.
I noticed something interesting. Laclede County doesn't seem to have a case. Could that be accurate?
That is correct. I double checked that today. There is no cases in Laclede.
Cases reported.
Correct. Confirmed positives, yes. No confirmed positives. So 86 counties, including St. Louis and Kansas City. And if you look at St. Louis County, that's by far the highest number at 1,393 confirmed cases in St. Louis County. So definitely that's at this point, the hardest hit area in the state. On the next page of the report, we talked about cases by age. The 20 to 29 age group, under 20 age group, we have 81 cases. 20 to 29, 474, 30 to 39, 447, 40 to 49, 564, and then the largest group in the age group of 50 to 59 has 744 cases, 60 to 69, 643, and then our 70 plus population at 583. Now you'll notice the deaths by age do not total. They hadn't updated that as of 2 o'clock, so these are yesterday's calculations. There's 1 death in the 30 to 39, 1 in the 40 to 49, 5 in the 50 to 59, and then 60 to 69 there are 10, and then of course the highest number of deaths are in our 70 plus population at 41. By sex, biological sex, males 1,659 cases, and females 1,830, and then 50 there that they haven't identified which category they fall into yet. Some new stuff, sort of. Most of you probably heard. Recent studies have shown that significant portion of the individuals with the COVID infection lack symptoms, so they're asymptomatic, because that's the reason we've had to do a lot of the things that we've been doing. What they more recently, within the last week or so, a study out of Singapore revealed that the pre-symptomatic period, so the period by which a person has been infected but have not acquired symptoms but eventually will acquire symptoms, was longer than they thought. Originally we were thinking the viral shredding actually started at the time of symptoms, then we backed that up 24 hours prior to. Now we're back to actually 72 hours or 3 days before symptoms that they can be infectious and spread the virus amongst others. So as we said there, virus can be spread between people interacting in close proximity, even if they're not exhibiting symptoms. Speech, vocal activity, singing have been known to cause those virus particles to become airborne as well. So makes that 6 feet even more important. The U.S. is reported to be in the acceleration phase of the pandemic. Here in Missouri, between April 5th and April 6th, the cases grew by 355, which was the largest leap we'd had. Although our regional numbers for our region right around here, the counties attaching us, they've held relatively steady. Greene County's jumped quite a little bit just over the last day, but coming out of the weekend, we only grew by, I think it was 5 cases, which is not good, but it's better than the doubling that the statisticians were reporting that we might see. So a little more stable than we anticipated. However, it's still anticipating that we could possibly still be dealing with this into sometime in June. That's a projection that exists. We don't know. CDC is saying that the cloth face coverings, such as the cloth masks, do help. They aren't 100% effective. Of course, none of the masks are 100%, but they will provide some protection. And we did learn that testing throughout Missouri is greatly improved. Approximately 3,282 persons have been tested to date, which is still needs to come up a little bit, but things are better. As far as the task force, the health unit reports 132 persons in Webster County have been tested, which of that 123 have been negative. 9 persons are currently quarantined, awaiting results. We still have the testing plan and everything in place at the fairgrounds, with the exception of the supplies to do so. Once we get those supplies, we'll be ready to go forward. And there is another test that's available, can return results in 13 minutes. 5,000 of those units were reported by the governor the other day on the teleconference. Will be here in Missouri. So as to where they're going to be allocated to exactly, we don't know. The next section, we just talked about the community information. It's the same information I've had on the report previously. I just wanted to keep that on there. State action since the last briefing. We know that Governor Parsons signed the statewide stay-at-home order, which also put some essential business occupancy limits restrictions. Basically, the businesses with 10,000 square feet or more were limited to 10% of their normal fire code occupancy. 10,000 square feet or less were limited to 25% of that occupancy. And we've been working to help the businesses achieve that here locally. Federal major disaster declaration was approved by President Trump for Missouri. And then as of today, most of you have probably already seen that Governor Parsons did close the schools for the rest of the academic year. I'm not aware of any county actions since our last briefing. Of course, they do have the stay-at-home order as well, but I think that was discussed in the last briefing. My actions since the last briefing are listed there. Mayor, if you want me to go through them, I can. Otherwise, you can look at them.
I actually do, for the sake of this particular meeting, yes.
Okay. We participated in conference calls with Governor Mike Parsons. I believe we've had 2, possibly 3 of those since our last briefing. Participated in at least 2 Webster County COVID-19 task force meetings. Performed research on essential employee definitions. Performed visits to businesses to ensure compliance with essential business orders. Drafted standing order for COVID-19 testing, obtained medical director approval, and that would be if we were to get the test site open at the fairgrounds. We have Dr. Alexander has agreed to sign off on that and provide medical direction for that to happen for our community. Obtained additional PPE, related supplies. Assisted businesses with understanding the new occupancy limits relating to the governor's order. Worked with the Chamber of Commerce to get the message out to the community businesses relating to that occupancy order. And then updated the Marshville Fire Department basic response plan and EMS procedures to keep up with the changing information. So we've stayed pretty busy. And then also today we did participate in a webinar with FEMA in regards to getting ready to gear up for the financial assistance, the reimbursement phase of this once we're done. Prevention measures, we just got to remember the hand washing, using the hand sanitizer, avoiding touching face, eyes, nose, and mouth, avoid close contact with people who are sick, stay at home, cover coughs and sneezes, clean and disinfect surfaces that are frequently touched, social distancing at 10 feet, or excuse me, 10 people or 6 feet, and then stay at home except for essential supplies or services. I think the things that we have in place are doing well. The community seems to be responding overall quite well. I don't really have any recommendations for changes in our policies that you have in place. The only thing that I would remind everybody about is the NIMS. Once we get to that funding phase, we will have to be able to certify that our board administration is compliant with that to be able to apply for those reimbursement funds. With that,
Let me ask you on that, Michael, as we're moving through that, does the board have what they need in order to, or do they feel like you have what you need in order to go on and go through those courses for NIMS? Is there anybody who's not sure what to do there? You can just show of hands and all. Okay, so
if you would just send the link back out, that would be great.
absolutely, we can do that.
okay, just want to make sure you know what to do, and they do. You know, they say that from what I can tell, the ICS 100 takes about 2 hours to go through. The 750 looks like it's taken about 3.5 hours, and then the 800 is, I haven't done the 800 or got into it yet, but it's supposed to be a lot faster because it's kind of a overview or whatever of the other two. So, but it will take some time to be set aside in order to go through those. I don't know, Michael, do you have any idea, or Sam, when we are going to get into that level of the financing stage? I know that a lot of it depends on how this all progresses, but just working with FEMA, what kind of time frame are we talking about?
Well, we had that teleconference today, and we really didn't get into a time frame. Basically, what they were encouraging today was going over the process and the biddings and everything that would need to be done. But the big thing right now they're saying is document, make sure we've got records of the expenditures and things that we're doing and how we're coming to the conclusions on who we use for contractors. For example, the good example would be the cleaning contractors. You know, what process we used and so forth. So documenting all that kind of stuff. But as for a time frame, I would have to get that answer from Lisa. She is she's keeping track of that, and I can get an answer, but I don't have it tonight.
Well, so I'm just looking to be able to tell the board, do we have just 2 weeks to get this done? Do we have, you know what I'm saying, 3 weeks to a month to get this taken care of? Obviously, the sooner the better, but.
Yeah, so typically in recent, in history of our FEMA projects, the ice storm, and we had some storm damage out behind the fire station and this and that. And so those were part of, let's just take the fire station. We just finished one up. In fact, you just signed the paperwork on it not too long ago, Mayor, just a meeting or two ago, just kind of finalize that paperwork. And it was from a 2017 event. And so that was 2017 was when the event was, and I've seen it go between 2 and 3 years for the reimbursement section to be finalized and the paperwork to be done, or at least submitted for review.
Yeah, that period's not even opened yet, and it may not open until we have what you would consider possibly the conclusion of this event.
And,
right.
And that is the period where we need to make sure that all of the elected officials have completed the NIMS training, is when we get into the application process, correct?
That is my understanding.
Yep.
Okay. All right, so there you go. Let's try to work through the applications on, or through the NIMS training if we can, and you can coordinate with Sam and Michael if you have any questions on it. It's really interesting stuff anyway to go through, and it really gives a good understanding of how not just the city and the county, but how all government organizations and other organizations work together in a system for dealing with emergencies. So It's, it's pretty fun. I don't know about fun, but it's interesting to go through. So. Michael probably thinks it's fun. But.
No, I don't.
You have anything else, Michael?
I do not, unless you have questions for me.
Anybody have questions for Michael? I have one just right off the bat. I noticed we've got numbers on how many have been tested. We've got numbers on how many positive cases they are county by county. Out of the 3,000 some odd tests that have been done, do we know we know 132 in Webster County, but how many of those tests have been done like in Kansas City and St. Louis versus our area? And what I'm getting at is that because we're seeing such a low number right now, thank God, right, of confirmed cases, is that partially because we're not doing the testing? Is it a possibility that it's because we're not doing the testing at the same level that some of the bigger areas are?
It's possible. I haven't really seen the breakdown by county or by city for testing, although that number may be available. I could probably get it. I haven't seen it. It's not been published that I'm aware of. But as we know, we are doing some testing in Webster County, but we don't have a mass testing site like some areas do, and Springfield, and I know Branson opened one just today, I believe. So testing definitely may make a factor in that, but we've got the clinics that are also testing, and while I am certain there are cases out there that we don't know about, I think testing is available now to everyone if they want to go get that test. So to answer your question, I'm not sure what that breakdown would be, but
I think it'd be good for us to just acknowledge too, though, that it's all appearances are that the action that's been taken by the board and other government agencies here at the county are being effective, at least in slowing the spread based on the numbers we're seeing versus the numbers in some other areas like Greene County, where they didn't really start until they were farther along in the process. So
absolutely, I honestly I would have anticipated a bigger increase in the numbers after the last weekend, and we didn't see that. And then we've just seen a moderate climb this week. So I think it's optimistic. What it means, I'm not sure, but they look optimistic.
Yeah, well, that's good.
I do have a couple of questions that sort of fit in this section of the COVID-19 response and how we're dealing with it, if it's all right.
Yep.
Okay. So one is, we in the last meeting we took some measures and approved for administration to make some adjustments within our city hall staff, and I think that was good and appropriate. But I don't know if I have an understanding about. I want to make sure right now. Is there any interaction inside the building with the general public, or is it just for employees to be inside City Hall right now?
So all city business is being done via phone or through the window. People can still just come to the window, to the drive-through window. It's locked down. It's not open. The City Hall is not open to the public, but people can still come in and do their business via the drive-through window. So
the drive-through window, but not the lobby window. Is that right?
That is correct.
Okay. So, and that seems absolutely reasonable to me. So a follow-up question to that. Do staff that are manning that location where they're interacting, do they feel like they are fully and appropriately, comfortably, however you want to put it, supplied with gloves? Probably don't need masks necessarily there because there's no real air exchange, so to speak, but certainly gloves and so forth. Do you feel, Sam, that staff are comfortable in what they're being provided as far as care to not transmit the disease?
I mean, I would never want to put words in their mouth, right? But I think so. I mean, I've expressed very strongly, if there's something needed to make them feel more comfortable or safe, that just to let me know and we will provide it. I
Okay.
think what we've have implemented has been very good, and I think that we're really limiting the exposure
Okay.
to the risk of it. And so, I would offer if you want to. I mean, we've got Karen and Monica and Melanie Brown, which is manning the office a lot up front. I'd be more than happy to unmute them and let you hear from them if they wanted to comment on it, or however you wanted to hear from that.
Yeah, sure.
Melanie, are you here with us? Melanie, can you hear me? Maybe. I'll see if she can chime in here just a second. I'll unmute Karen here, and then I'll do the same thing for Monica. They're still here. Some they've got to be in and out, but I'll let Karen say on her end. Seems to be a little bit of a delay when I go to unmute somebody. There she goes.
Well, because it tells me I have to
Oh,
connect,
okay.
so,
Okay.
yeah, there's gloves provided. There's, there's everything there that I feel that is good. I think with the door being closed, that helps because we just have to deal with the drive-through.
Okay.
So I feel like we're completely covered there. We don't allow anybody in the building.
Okay.
That's
good.
not.
I'm glad to confirm that's good. I expected as much, but I just wanted to be sure.
Yeah.
Okay, so another aspect of staff interaction involves some that do have to go out. That includes the road crews and water crews and sewer crews and so forth. We've also got police and fire who are out there directly interacting. So question is, as a city, Sam, this is more directed for you, and then you can decide if somebody else needs to speak to it as well. But for those departments that do need to be out and about, and maybe where city staff, we're talking about water and so forth, we've taken measures also that there doesn't have to be as much direct necessary interaction with citizens. But to whatever extent that's the case, and definitely with fire and police, what is the city availability of personal protection equipment, including face masks and gloves, and to whatever extent necessary, even eye protection?
So I've got. I'll let Michael talk about the PPE for the fire department, and he might even be. I know he's worked with Doug. Doug has got some supplies from him as well. So I'll let Michael hit on that, and then Richard, you can kind of prepare yourself a little bit, and we can talk. Richard Neville's our utility superintendent's on here as well, and so we have taken some action on those as well to restrict that. But Michael, why don't you go ahead and on your end?
Sure. So for our personnel, of course, at the beginning, I think you actually had a copy of it, maybe at the last meeting, the basic operations plan. We made some response modifications that would limit the exposure of our personnel. We did that for a couple reasons, to the potential of getting infected by limiting on the sick calls and the respiratory calls, that if the ambulance is in town, we're holding our people back. That way they're still available. And then if they need us, they can request us, or if the ambulance is not in town, we respond as we always do. So that was one method to reduce the exposure of our personnel unnecessarily. As far as PPE,
just to kind of keep up with you, so that means you've made the adjustments that you're actually holding back on what you would do under normal circumstances as far as dispatching people and responders to literally if they are very specifically needed.
Right, to two call types, the type of call, the sick calls, which we refer to them, and the respiratory calls. So we've made some adjustments there, and we have it dispatch as well to help to make sure that we're where we need to be, but we're not where we don't have to be. If that makes sense.
Right, and we can stretch out the inventory of that PPE then. Yeah.
Right, and then we had personal protective equipment that we keep in stock. And we've been able to, due to some long-term vendor relationships, still buy some. And then the state just recently, and we've got some more coming Tuesday, started getting some supplies. Currently, we do have an adequate supply of N95 masks. We do have an adequate supply of gowns, of protective eyewear. We've got some surgical masks, which we need more. Our medical director wants us to start using those on every EMS call. So we had enough to kind of start that process. Natalie's going to help us with some cloth masks that'll bridge the gap till we get more surgical masks in. And then gloves, we are adequately supplied. As for PD, we kind of helped them with some training. My training staff taught them how to use and properly put on and take off that gear. Cox assisted us getting some N95 masks for them. And then we did the test fit for them so that we know that those masks are sealing properly on the police officers. So they should all have those.
Okay, so I heard you say you guys, the fire department has plenty, and that the police has been helped with some. Is Doug on this meeting?
No.
To what extent do you know, so they've been helped, do they have all they need as the fire department does?
I know that Doug had, in my conversations with him, they already had the gloves, an adequate supply of the gloves. The masks were very limited at first. Michael, you can speak to, they get their masks from another source, and I know that they got some from the fire department initially. I'm not sure if they've got the additional mask in or not. I will tell you that just like Michael is with the fire department, they're limiting their response to calls to those things that are necessary. So, for instance, they're not just responding to an ambulance call, unless they're requested to respond. And so, limited contact in the same way. The only question I would have is whether or not they have their supply of masks in. I'm not sure of that.
Is that something that Sam would follow up on to see if there need to be additional anywhere across any of the departments?
To find out about it. After this, I'll matter of fact, while we're sitting here talking, I'm putting a text together to ask him that question unless Michael knows.
I know how many that we initially supplied them with. I know Department of Public Safety was going to be sending out some additional masks, which we received. But I don't know if Doug received any or not from that last shipment.
Okay, if we don't otherwise, I'm sorry, Mayor.
I said I'm not sure on the mask either, but I'm sending a text out and I'll be able to answer it if he responds. So
okay, if he's not able to respond in this meeting, I'd be interested to make sure that there's a follow up to that across departments, that we're protected, and when we do have to respond, we're protected in the way we need to be.
I know that the masks they're released by the state, right, Michael?
Yes, we were able to buy some, and the state is also releasing some, but it's been very slow coming. We are starting to see them show up though.
Yeah, and the police department has a path that they go through to get access, just like the fire department does. So
right. Whether
or not they're available, I'm not sure what we have on the mask, but I do think that we have a avenue to get them anyway. So we'll see if Doug answers on the mask, and I'll let you know. And yes, we will make a special effort following the meeting to confirm and make sure that everybody, it never hurts to go back through and make sure everybody has what they need to have and what makes them feel safe. So
thanks a lot. Sam, you said that Richard would tell us about on the
Yep.
city staff that's out.
Yep, and so I'll pass this along real quick. So Melanie's computer doesn't have a speaker to speak into. She is visiting with us. She's here with us on the call, but she did text back, and she said, I agree with what Karen said, and also appreciate the professional cleaning that is happening. So that's been a huge comfort and relief for us as well, because they really have done a really good job and making us feel safer in the environment that we're in, right? And so that's been greatly appreciated from all city staff to the board. So thank you for that. I'll take a real quick second here on the water and sewer, as far as what I know that I've passed along, what we've implemented, and let Richard get down a little more in the weeds. You know, the board graciously gave a little bit of leniency as far as to do what it was necessary at the last meeting, which has been a big help. And so I know there's a few employees that we've kind of split some things apart as far as some duties. And so we've kind of got a building for most departments. We've got a building guy that's basically taking care of the building and supplies, and kind of a delivery guy, just kind of manning the shop and manning the equipment, so that if it's got to go out, then they're taking care of that. So it's limited to in and out of that same equipment all the time to basically one person. And then same thing in the shop, in the office area. Same thing in the sewer and the street department. And then there's a couple guys that you probably see some vehicles out and about headed towards their houses and stuff. So some of those guys can just go straight to the job site instead of having to come in and go through the building and get their stuff ready. But I'll turn this over to Richard, and then I've got Rick on here as well if you want to hear from him. So, Richard, can you hear me?
Yeah, I can hear you. Can you hear me?
Yep.
Yeah, like I said, we split those up, where there's nobody showing up at the same place every morning, and usually just one guy, 2 max per building. And then the gloves and sanitizer, we have plenty of those. And as far as and of course too, last week we had 5 different sets of contractors in town to deal with. And so we've limited the buildings to employees only, and even with deliveries and everything. So they've got their own facilities and to use, and then we do try to keep our distance as much as possible with the public. I mean, yeah, still have to deal with them a little bit, and hand out some notice and stuff on the door, but everybody that I went up to on doors and stuff, even they've been keeping their distance. And so I think everybody feels pretty safe about it yet. We don't have any masks, if we need those, I need to talk to Michael about that. But other than that, I think we're all right so far.
Yeah, and so we've implemented too, basically if somebody goes out of town or out of state, that they've got an email out there knowing that if they do that, they do that at their own risk, and they may be self-quarantined, for up to the 2 weeks. So we put some protective measures in there as well. And like Richard said, everybody's being pretty distant. They really are.
Somebody has a TV or something on in the background. Maybe they could take care of that.
I'll mute Richard there unless he's got something else. You can give me a wave or a nod if you've got something else to add. But yeah, the leniency's gone over really, really well, and it's allowed us to do some things that we typically wouldn't do. But I've got Rick on here too. I'll just give him a quick minute. That way you guys hear from kind of city staff, and it's not just coming from me. Rick, are you there?
Yeah, can you hear me?
Yep. You might, obviously you're a crucial part of just keeping things going in the city and keeping people in compliance. So you might give them a breakdown real quick of what you're doing. I will say that Rick and Richard both, I've kind of got those guys isolated to themselves and really asked them to work from home on everything that they can and do everything via phone call and conference call and Zoom, and everything they can through email rather than having to be in this building or even in their building. And I will say, props to them. They have, I know Richard's juggling lots of stuff, and he's done really well with it. So I'll let Rick talk about his end.
For the most part, construction's still going strong. We're still getting more homes coming in. I don't know if you guys been to Riverview. I think there's almost 6 or 7 projects going on over in the Riverview subdivision right now. So homes are still building pretty heavy. Mayor's getting closed in over there where he's at. So I don't know if you guys been by Domino's pouring concrete now, so they're starting to get going. We have a big project for Tyler Pipe is putting on a huge addition, and then also Anderson ACGI is getting ready to put on a great big addition to their place too. So we've still got a lot of building going on in town. Everybody that I've dealt with keeps their distance. Nobody's getting in your personal space. All the contractors around are real good about it. Those guys are friendly. They like the handshakes, the back slaps, but they're all keeping their distance and everything. So still, I've been kind of patrolling the shopping centers and making sure as much as we can, everybody's holding to the closed notice. They're doing real well with that. I mean, there's times that it seems like a Sunday around here in Marshfield, so everybody's doing well.
And Rick is Rick's also an integral part of Michael's fire department too, you know, of heading that up. And so he's receiving the same training and probably even helping with some of the training. So he's very well versed in that stuff as well.
That's all I've got, unless you guys got some
Just to
questions.
close out the this part of the conversation, unless there's other questions, that our city staff is doing exceptional in dealing with this, and still maintaining the level of professionalism and expertise that we need for the city, staying safe at the same time, and working very hard to keep our community safe. And in addition to what they're doing, our community is responding exceptionally well. You know, we've almost anybody that we talk to, it is a struggle. It has to be just a huge struggle for these business owners and people in our community that are limiting their activity. We all know, because we're doing the same thing. But what we don't see is, we just don't see a lot of discontent. Everybody seems to be willing to do what we're doing right now for the better good. And I just say kudos to Marshfield. I mean, they're, and we see, I believe we see the results in the numbers that Michael's talking about. And so I think that's a positive thing. When this is all done with, you know, I pray that we're all going to look backwards and say, well, we went overboard, because that will be a good thing if we can do that. And so, are there any other questions on the COVID-19 update? Let me bring up one other thing that it was an interesting thing that was brought up. The board doesn't have to address this right now, but I can bring it up under COVID-19. And that is one of our businesses asked a question of, since the businesses are having to close during this time, will the city do anything to help on the, not the usage fees, but on the standard fee that we charge for water and sewer? I don't know the answer to that. We haven't put a ton of thought into it, but that question is out there that we may want to deal with in our next board meeting when we're together, of what, if anything, we will do in regard to utilities and those types of things. So moving forward. Doug says that he has an adequate supply of masks. So
That sounds like everybody. That's good. That's great news.
Yeah. So, all right. Any other questions on COVID-19? All right, then we have Joe Kinder's on. I'm looking for him here. I don't see his face. There he is. And he's going to give us an update on the water and sewer revenue bond and the issuance.
Yes, hello everybody. Thanks for having me here virtually this evening. It's good to see some different faces. I love my family very much, but I'm also ready to get out of the house at some point. So I appreciate all the work folks like you are doing to keep the state of Missouri safe and keep our communities rolling. And moving forward, I just wanted to provide you a quick update on what's going on with the sewer and water revenue bonds. Now that we have done the issuance and closed the SRF portion of your $10 million of authorization, we are on to the portion of the issuance that will be the actual revenue bonds outside of the SRF. So you have an attachment that I hope everybody has available from their board packet. That's kind of a color-coded chart that is a cash flow summary. I just wanted to briefly, before we get into that attachment, talk about what we're doing and what we're trying to get accomplished. And I apologize, in order for my Zoom to work, I cannot access any of my files because of our data speeds and what kind of data that Zoom eats up. So some of this Scott may have to chime in on some of the more detailed project side of things, where Sam.
Hey Joe, do you want that attachment brought up now?
No, I was able to print it off. I just, you know, if we start talking in depth on what projects we're going to get done, I may need some help from.
Do you want that? Do you want that page? Do you want that? I can share my screen. Do you want that page up that you sent over, that color coded one?
If people need to see it, yeah, that would be just fine. If everybody's got it in front of them, that's fine as well.
Let me put it up there just because we do have some people visiting. Let me go ahead and put it up there, but you can start walking through it, and then I'll put it down, and whenever I think it's appropriate, and then if somebody needs it back up, I can get it up.
Sounds good. So to review a little bit on the SRF, which I know you all got going and have everything working on that side of things, is what we have utilized here is a common plan of finance. So as we look at what you all are doing with the $10 million of authorization you have as for the new money projects, as well as the 2003 SRF loan that you had outstanding that you're utilizing your current system revenues to pay for, is we've actually gone and combined basically the new issuance of the SRF loan simultaneous with a refunding of the current SRF loan from 2003, and then this new revenue issue to create kind of a unified picture of debt service over a 30-year period to make sure that you've got the coverage ratios necessary from a revenue perspective within your fund, within your sewer and water fund, to be able to do these projects we feel comfortably and safely, as well as try to raise enough money to do as many of these projects as we can as we work through your plan. Now, this particular spreadsheet on the revenue bond side of things, we're only issuing the remaining $4.655, I believe, million, $4.665 million of remaining authorization. But that produces a little bit over $5.1 million for construction projects. So we get up close to and around a number that provides you to do, you know, the set of projects that I'm blanking on when we did that as a group, or when you all did that as a group, but here about a year ago, I feel like, or maybe a little more, you prioritized when you realized, when we found out what costs were for all the projects, we prioritized the list of the projects, knowing that we could get, you know, about 5.1 or a little bit over for this portion of the funding, which would be the revenue bond side of things. So parcel with the other $5 and change million that you did through SRF, this will produce another $5.1 million for you all to do actual projects and improvements. So the plan is to come back at your board meeting in 2 weeks with final rates and final pricing, final amounts, everything finalized, fixed rates throughout the life of the loan, to have this remaining portion issued, authorized, and hopefully in your pockets quickly. I know you're starting to spend some money on some of these projects, so it's time to get that money in the bank. But what we have here, this cash flow itself has a bunch of different columns on it, color coded for you because I like to do that. But the gray fee the gray box is just going to be what your CIP fee is and what our projected revenues are there. You've got a current revenue bond fund that you're currently utilizing to pay that 2003 debt that we're also including in the blue box to get a total revenue amount. We've got your SRF loan payments plugged in there, and these are all calendar year basis. And then we've got a projected schedule for your 2020 revenue bond payments. We've got some interesting times in our market now. So if we were in the market right now today, this would look a little bit better than this. Ordinarily, I'd say we're almost certain to do that, but things change. They have changed more in the last 3 weeks than I've seen them change in the last 13 years from a rate perspective. So it's been pretty incredible to see the flux in our market and the instability, but things are starting to come back around a little bit, and we feel like a couple weeks from now will be a good time. We've actually been able to price some deals into the market and do just fine. So we've got those 2 sets of payments for a total set of payments. And one thing you'll notice on that total payments column is we hold you between $579,000 and $590,000 a year versus $762,000 of revenues. So we create a nice surplus there in your debt service revenues that you're utilizing to make those payments, which is something that investors want to see, but also particularly in times of economic uncertainty like right now, it's nice to know that you've got some significant coverage in terms of additional revenues coming in the door. In this case, it would be, you know, we hover around 130% for the next 15 to 20 years, and then it actually goes up from there. when you start paying on the bulk of the revenue bonds. But again, these bonds are going to be borrowed at about, let's just call it about 4%. Now we're talking about going out, 30 years on these, with the vast majority of the principal payments being towards the end of the actual structure itself. And that's because we're trying to, again, create a common plan of finance between the SRF loan, which you borrowed at below market rates and actually borrowed at a tremendous time in the market, and these revenue bonds. And so I think between the two of them, while we say, okay, the revenue bonds will come in about 4%, I think you were about 2% on the SRF loan. Is that right, Monica? Yeah.
Yes.
So, as you look at it, it'll be an average interest rate between the two issuances to get a little over $10 million in proceeds. You'll be looking at, almost $11 million in proceeds, actually. You'll be looking at paying about 3% interest on over 30 years on your sewer and water revenue bond improvements, which is a tremendous deal. I mean, historically, as you look at that, regardless of when you're looking through time over the last 40 or 50 years, that's going to be a fantastic deal. So a few things I wanted to highlight. We did go out and get a rating on the system. Sam and Monica got grilled by S&P for about an hour, and Standard & Poor's came back with an A rating and had a lot of really, really good things to say about the system and about the management, about the job that you all are doing and the job that your administration is doing to run that system. And that was a really, really good result. We got a great write-up. If you haven't sent that around, Sam, hopefully that you all get a chance to read that and see some of the good things they had to say about you all. But that was tremendous. One thing that we've done as the market has gone a little crazy over the last 3 weeks is as quickly as we can move in our market. This is a bit of a slow thing because of the regulatory bodies that regulate you and us as well. But we have added another layer of credit protection called bond insurance. It's basically what you would call similar to any other insurance you would buy, which is it's a guarantee that payments will be made if something were to happen in the short term with system revenues. We bid it out to two different companies. We had a company called AGM, or Assured Guarantee Mutual, put the lowest bid on the revenue bonds. And what that does is you pay a premium up front to get lower interest rates. That comes with a AA rating. So you'll have a AA rating along with your A rating on your system itself, which will help us lower the yields on that issue and save money. When we were doing that analysis prior to the upheaval in the market, we weren't coming up with numbers that were saving you money effectively over the life of the loan or the revenue bonds. We think right now that's going to save you anywhere from $250,000 to $400,000 in total debt service because of the value that people are placing on the AA credit. They place a lot of value on your A credit, but we're in the midst of what we call in our industry a flight to quality. So the higher your rating can be, the closer to that AAA. So we've got AAA, AA plus, AA, AA minus, A plus A. The closer we can be up to that AAA, the more investors we have as people have tightened their belts a little bit, and also the greater cost, the greater price, which is the lower yield for you all we can achieve. And sometimes those don't match up. And prior to the upheaval in the market due to COVID-19, we were seeing that your rating was plenty to get things done. We were seeing not a big enough difference in the rate to pay for the insurance premium. That has flipped on its head. So as we go through this flight to quality, we've been able to acquire insurance. We're going to put that on the bonds. So that will be an additional credit enhancement that will have a fee with it. But I will show you when we have final pricing, the difference where we felt like a deal would have priced between the two, so you can see the difference and what that actually saves. But otherwise, it's very similar to all the issuance we've done over the last 3 years here, I guess now. We plan to come back with final rates and have you approve the final rates and the final amount that you all will be getting at the board meeting at the end of the month. We are prepared to do that. We feel like, historically rates are still very low. While they're not as low as they were 3 weeks ago, still great time to be borrowing money. And that's pretty much the summary of what we're going to come back with. Wanted to make sure you all had a chance to kind of get that back fresh in your brains and ask us any questions before we brought anything to market here in a couple weeks.
Hey, Joe, is that, did we ever get the final, we got the draft back from S&P, and so I haven't sent that out because it was just a draft. Have you seen the final? from
I have. I apologize that you haven't gotten it. I will send it. You know what? That was one that went to John. So I'll.
Okay.
I didn't send it to you. I'll send it to you.
Okay, perfect. No, that'd be perfect. Yeah, I didn't want to send that draft out until it was final. So.
Right. Thank you, Joe. Does anybody have any questions for Joe on where we're going with the bond? So when are we planning to bring that back?
So I think we're probably gonna really need to get together for an actual in-person meeting. I think I talked with Joe, and I've talked with Gilmore and Bell too a little bit, and I think I think it'd be better to get together in person to vote on that actual closing of that bond issuance. And so we got that scheduled for just our normal second meeting in April. So April 23rd, we'll be bringing that on there. And then, the timing of it, as Joe said, it's a good time. It's a good time for on the financial side of it, but also, and Monica could chime in if you guys wanted her to, but probably, Richard talked about, we got several different contractors in town. Some of that is SRF work, which is pretty well a 10-day turnaround for reimbursements. But this side of it, we don't have a way to, this is our mechanism for our reimbursements. And so we're spending cash on some of this stuff just to get the projects rolling. But it's all reimbursable. But Monica and I have talked in great detail on this, and very comfortable going through the end of April. Would not want to see it go through the end of May for sure. We'd want to, depending on some of those, it's slowed down a little bit because of the COVID-19. People are having a little trouble getting some supplies and getting stuff going. But the timing has to do with, we don't want to get stretched too thin on the cash. And so that's the reason why we're bringing it back to the next meeting.
Sure. Okay. All right. Thank you very much, Joe. Appreciate it.
Thanks,
And we'll go ahead with the lift station, number 6 capacity analysis.
Yeah. So I've got Mel with us, and I'll get him on here if you have any questions for this. I don't know if you'll have very many questions for this, but you probably will on the next one. I mean, as you guys are all aware, the interchange is in full swing. I don't know if any of you have been out in that area, but boy, they have really they've really moved some dirt. We went out there. Mel and Richard and I went out there with Tucker from CMT the other day, and he kind of ran over the property with us there on the west side, and man, just moving large amounts of dirt. And so hopefully at your next meeting, we'll have another drone flyover, and you guys will be able to see the difference. And so they're really killing it. So one thing that we haven't, this kind of ties together with this agenda item and the next one, but I'll kick it off with this one. One thing that we have, as I dive more and more into the sewer side of things, we have not, city staff just doesn't have a great grasp, detailed grasp of the capacity inside of our lift stations and inside of our sewer collection system. And so on the water side, which is what I pretty well cut my teeth on, and Richard as well, I got a really good grasp on where we're at, and I think we're sitting in a really good place. The first part of expansion, being able to expand to, say, the interchange, or even on the south side, if somebody wants to develop over here on the south side, or further develop out there by Golf Course Road, is going to be, for city staff, we need to know what those lift stations, what they're capable of holding as far as future flow, and how much can they expand on. If are they at capacity, are they close? And so what you've got in front of you is tonight, we've had, Rick and I have had multiple calls about development possibilities out towards the new interchange. All the calls that we have filtered so far have been on the east side of the interchange. And so the number one question, we've presented with them the board's, what the board approved as far as expanding that water line and doing that loop up and around along the new CC and back down to the new pool. And so everybody's been super excited about that and glad to see that's up and going. But their next question is, okay, what about the sewer? If I wanted to develop this property, or if I wanted to buy this property, how would we hook on, or what would we do, right? And so right now, Mel and I and Richard have been talking, and Buck, our wastewater superintendent, we've been talking, and you know, there's different watersheds out there. There's I'll let Mel hit on it, but I think there's 4, maybe 5 different watersheds. That it depends on how far out you want to go with the development portion, or in the development size. And so this first work order for lift station 6, that's right there at the bottom of the hill as you're going out North Marshall. And so right there before you get to that last subdivision before you leave the city limits. The portion right there along, if you can imagine where the east side roundabout's going to be, and where the basically the bypass for the Marshall Street is going to swing off of there. A large portion of that right there, up to about that tower, will gravity feed down to that lift station if we so chose to do to allow it to do that, depending on future design and this and that. The problem is that we don't know whether that lift station will accommodate a major water user, or if it will accommodate something such as 1 convenience store or 5 convenience stores. We don't have a great grasp on that. And so the next agenda item is going to be to do a full-blown capacity analysis for the entire city, and the sewer lines, the lift stations, everything. Because I think that the transportation side is a little ahead of the sewer. The transportation and water side is a little ahead of the sewer development out there. I asked Mel to put together a work order that would pull out this lift station 6, because that's the property that we've been that's the lift station what everything would flow into, that we've had multiple phone calls about. And so what's sitting in front of you tonight is a work order. As you guys know, Great River is our on-call sewer engineers, and so it's a work order to do a capacity analysis for lift station 6. And you may want me to go into the big picture, want Mel to go into the big picture for the next agenda item before you just decide to single that one out. But tonight, it is on there. It's up for discussion. It's not. You guys could approve it, and it would be great if you did approve it, so we could get the ball rolling. It is not. It was not figured into the budget, into this budget. The SKEEP grant was figured into the budget as a priority 2. It is within my purchasing authority, but it is not figured into the budget. That being said, there is a capacity fee account for the water, for both the water and the sewer account. And so we've looked at that, and to my knowledge and to our records, we haven't spent any of that money since that fee was established. And that is specifically what that fee is for capacity and expanding capacity. You know, we had a projection for this year. I was hesitant to follow through with that just because of where we're at, to present that because of where we are with the COVID-19. But I will say that at the end of 2019, there was roughly $60,000 in the sewer side of that. And so just want you to keep that in mind as Mel kind of goes over the SKEEP grant application and what all we would get out of that.
So before you toss it over to Mel,
Sure.
As you know, it's been a number of years now where the board has requested that anytime as you mentioned, this wasn't budgeted for. So what we have consistently asked for, and I think would still hold to, is in order to approve it, to see, okay, what comes off the budget to make this work. So I don't know if you've prepared for that tonight or not, but when it does come up for a vote, I think that'd be good to speak to that.
Yeah, so I mean, I can speak to it now without, with limited, obviously, just without diving into the budget and the research. But I don't think that this is I don't think that this one would be offset. I don't know that we could offset this one. I think that I did think about that obviously before I presented it, and I knew that would absolutely come up. But that's also why that's also why I'm proposing that we use that capacity fee or that capacity account to pay for it.
You're
We
saying the
talked about
capacity
putting
fee is
this on the
otherwise budgeted?
agenda. We understood that the board would likely not want to vote on this tonight, and
Sure.
be able to take the opportunity to consider it. I think that looking at the presentation on the SKEEP grant, and I also want to say that, you know, I know, Rob, while you're saying that the board wants to do a exchange, in other words, you add something, you take something off. I don't know of any action that the board has taken to require that. We certainly try to do that. We want to do that as much as possible, but there's no reason that the board cannot, in a situation where something makes sense, approve adding something to the budget, especially whenever there's a revenue fund there that is designed specifically for that type of thing that we're not going
So
into.
a question to maybe make that easy is a different way of saying that, just from my understanding, that those dollars haven't been budgeted into any other expense. So they just remain, it's
Right.
not that they're being used for anything else anyway.
So it's a standalone account, right? So you've got
Right.
so you've got the sewer operating, right? So you get the sewer operating, which has, you know, it was to the positive in the budget this year by just a little bit, but it's set aside. It's not figured into the cash.
Yeah.
In that side, it is its own standalone account.
Yeah. So I mean, the simplest way to put it is you're talking about using funds that are not otherwise encumbered by a budget or a plan.
They are restricted funds for this purpose. They are specific to
Similar
capacity.
purposes, right? For the expansion.
They're specifically dealing with capacity. Yep.
That part I get, but the specific part of my question is those aren't, those funds exist. So, and they existed even carrying into this year, but there was no budget to use those otherwise.
We have,
Yeah.
Monica, I'd have to go back and look, but I mean,
That'd be good.
I think we did, but I don't think we've ever spent any money out of that account since that fee was set aside.
Okay, well, I'm getting mixed signals. I can't tell if you're saying that they're not, you haven't got a use for those yet otherwise anyway, or not for 2020.
No.
Let's let Monica speak to the question as I understand it is there any budgeted expenditures going against that revenue that is restricted for those purposes?
That's right.
So for the past several years, there have been no budgeted expenses for either the water capacity or the wastewater capacity fees.
Okay.
And we've budgeted the revenue coming in, and they've been setting in an account set aside, but no expenditures have been budgeted for those funds.
For me,
So
that answers it for me. That's good.
Okay.
And those accounts are added to out of the revenues on a regular basis?
So every time that Rick sells a building permit, there is so for say the residential side or commercial side, there's different equations in there. But so what that is so you'll have a capacity fee on every permit that they do, and so that's figured in. Some of it's so minute that it's so many dollars and cents per sink or per stool or per connection. And so those dollars just off of every permit, there's a portion of that set aside for the capacity. So when you get a permit issued to you, there's a specific line item that says capacity fees.
When just a general, for my own knowledge, this may be a dumb question, but when these lift stations were initially constructed, I mean, was there information at that time about their potential capacity? And I mean, that could be utilized without us having to go back in and look at each one across the city? Or are there some that are already, we know they're tapped out, there's no room for expansion? And
yeah, there's one or two that we know that they're basically at capacity or close. And so, yes and no to answer your first question. We can provide all that information to the engineers and stuff, but you got to keep in mind too that this is my 20th year here, and since I've been here, there's only been other than the lift station at the pool, only one of the other 12 have been redone or replaced since I've been here, and so the development has changed all of that original stuff, so they're several years old.
So it's ancient information.
It would be, yeah, really. I don't know that it'd be pertinent information. But with that, I mean, if nobody's opposed, I'll turn this over to Mel, but if you guys got any other questions on that side of it, I'd be happy to answer anything. Okay.
Let's hear the broader presentation on the SCEAP grant, and then I'll ask the question to the board if they want to address any of it tonight.
Okay. And so just while this is waiting, while I'm trying to get this open for Mel, keep in mind that what we'll be asking from the board either tonight or at another meeting, what we're actually asking for in this agenda item is for you guys to approve a SCEAP grant. And so what that is, it's through the Missouri Department of Natural Resources. And so it is a match grant. And so I'll let Mel walk through what all that consists of, but it is limited to current infrastructure. It's not for future growth. It's not for future purposes. It's really for, it's a engineering grant that is for current infrastructure.
Just one clarification on that before Mel comes on. What the approval would be for, whether it be tonight or in a future meeting, is for the city to apply for a SCEAP grant.
Yeah, so we're obviously not
approving the application process.
Yeah, right. So as you guys know, we're required to have board approval before we apply for any grant, and so that's what we're doing. Obviously we're not guaranteed the grant, and then there would be paperwork done. There would be paperwork brought back to the board to approve the grant if we're awarded. It's not a quick process as anything with the state, but Mel can touch on that too. It would be a few months before we would even know if we were awarded or not.
All right.
Hi, Mel.
Hi. Can you guys hear me?
Yes.
Okay, so I'll tell you first a little bit about the SCEAP grant, and then I'll give you a little background as to what I've been talking to city staff about related to this. But the SCEAP grant stands for Small Community Engineering Assistance Program, and it's a grant through Missouri Department of Natural Resources, and its intent is to offer small communities funding for wastewater engineering costs and to prepare a facility plan, basically a plan on how to deal with infrastructure, necessary infrastructure improvements. And so it's kind of a matching grant. Well, I guess first off, municipalities, counties, and some other public water and sewer districts and that type of thing can be eligible for it. You have to have a population of less than 10,000, and that you can do the application at any time during the year. Some grants that have a deadline. You can do it any time of the year. It's a first come, first serve basis to see who gets the money. Generally, it takes 3 to 4 months to get one of these turned around and approved. With what's going on with COVID-19, it might take longer. I'm not sure, but I think we need to at least plan for several months for it. And so essentially you can get up to $50,000 of grant money, and that requires a 20% match. So essentially you can do a $60,000 study with this grant application. There's also some, if you're a disadvantaged community with less than 3,300 and that type of thing, there's some different things, but I don't think that applies to Marshfield. So essentially we've been talking about this for a while and how this might benefit you guys. And like Sam said, you guys have got a pretty vast infrastructure in sewer that's been built over many, many years. And, you know, the original plan is not necessarily how things developed and that type of thing. And I've worked with you guys long enough to know that, like Sam said, you don't have a good handle on the capacity of your components of your system. And that's not uncommon. That's actually what we run into in most communities. And so, what we're proposing to do, and there's different options, but what we're proposing to do is to take a citywide look at your sewer infrastructure and take every component, whether it be a gravity sewer line, lift station, a force main, the treatment plant, and assess, okay, what is the capacity of each component? How much sewage can it handle? How much is going through it now? And then to look at your projected land use and say, okay, what in the future is this need going to be? And then take and say, okay, these are the infrastructure improvements that need to be planned across your entire city, and then come up with a cost, basically a conceptual plan and cost estimate for each, and help prioritize, work with you guys to prioritize the order in which you might want to complete those. So kind of like a capital improvement plan over several years. And then the initial projects that you might want to implement, we'd be documenting those in a facility plan and looking for how we can move those projects forward through DNR. And so that was what I was asked to kind of look at, what that type of scope of study would look like. And so I don't know, have you presented them with my conceptual work order, Sam?
Yeah, so I've got it here. I've got it ready to put up there. You want to go over it?
Yeah. So essentially, we first looked to see what would that scope. And so that scope is greater than the $60,000 that we talked about before. Your infrastructure is too vast to get done in that. And so one thing we could do is we could try to pare down and not look at the whole city. Let's look at portions of the city and try to keep the scope within that. And so if we were able to do that, you would end up, the cost to this would be $50,000, assuming we get the grant, $50,000 from SKEEP and $10,000 for the city match. But in talks with the staff, they're like, we really need to get a handle on the overall system. So if we look at the entire city, you're looking at just under $90,000 to do that study. And so that's what we're kind of conceptually presenting here. Obviously, you can do whatever you want or none of it. But if you want a global look at the entire city and get your arms around where you're at and how to handle your existing and future planned sewer usage, that's what we'd be talking about. And then obviously you could pare that down to anything below that. And so, so what we're asking for is do you see the value in this? Do we want to push forward and try to get the SKEEP grant, which would allow you to do at least a big portion of this?
And so what the so lift station 6, the lift station 6 capacity basically kicks that's just pulling it out and putting it at first in line is why it's separated out, just because we are starting to get questions about what would we allow to hook onto that drainage basin.
Is lift station 6 the $4,200 or $4,830, whatever it is still built in at 89.5, or would that come out of that 89.5?
So the 4835 is a separate fee, and the reasoning for that is we could throw it in and just wait and do it all at once, but the concern is that this is going to take several months to even know. By the time we go through your approval process, if you choose to chase this grant down, and then we apply, and then we get permission to start and get results, you could easily be 4, 5, 6, 7, 8 months out. And Sam's concern is your interchange project is already moving so far ahead. He doesn't want to be in a position, or doesn't think you guys want to be in a position where somebody comes in and they're interested in developing land and you don't know whether or not you have any sewer capacity. So he asked me to pull this out to try to be a little bit more proactive on that area so that you have some answers ahead of this bigger study.
So that's not, just want to be clear, right? So that everybody can ask any questions they want to. I want to make sure everybody completely understands. So that lift station 6 capacity, that's not for the entire growth area out there, right? That is just for what would gravity feed into 6. And so, that's not the entire portion. At your next meeting, Mel and I and Richard had a meeting this week. As I said, we went over that, the interchange area. And so we went out there. Mel will have some maps with the different drainage basins, pointing some of that out. And so it'll make more sense when you can see it on paper, the topography and how that drains from one side to the other and where those breaks are. But I don't want there to be a misconception that this is for that entire corridor. This is just for what would gravity feed, which would be basically from the tower, from where that tower is back to the south. That's what it would be, is just for the gravity portion.
I've got a question. So this would help us understand what the capacity is, but you did mention what land area will gravity to it. I'm assuming when we put that in, we put it there because we knew what would gravity to it. Is that accurate? Do we know what will gravity to it?
Lift station 6, Rob?
Yes.
Yeah, I know what can flow to it because I've got a topographic map in front of me, but it's never been officially mapped out, at least in recent times. So, and that's what I'm going to create for you to present to you at the next meeting.
Okay, so quick question on where we are today. So that lift station has been there is number 6. So is that the 6th one, I guess, to go? It's about the middle of the age of our lift stations.
Yeah. So I'm going to unmute Richard while you're talking here. Richard, do you have any idea how old that lift station is?
No, but he is right. I mean, Rob's right on the 6. They've all been put in order, and so yeah, it's mid-range, but I'm saying it's close to the 20-year mark.
Yeah, that one did have some. That one did have
barely over.
That one did have a few improvements done on it. Now,
Yeah.
Small improvements, not rebuilt, but it did have some small improvements on a long time ago.
So would it be our practice today, if it was not before, because it sounded like Mel can tell, but I think he maybe made the suggestion that maybe as a city we don't know, but would it be our practice going forward if we were going to install equipment like a lift station? There may be other things that are similar to that we would know going in what is the area specifically in a detailed way, what would be serviced by it, and that we would know that the capacity of that would handle the service area going forward. If we didn't in the past,
yeah,
would it not make sense to do that study before to make sure that the investment is a valid one in a particular location?
Yes, that is where we want to get to. We've been playing catch up in Essential on the sewer side, and so absolutely it would be nice to get to that point.
Yeah.
Bill, in your experience, let me ask you a question. I'm sure you've dealt with multiple cities on similar things like this. Is it unusual that a city would not already have mapped out this information for their lift stations?
I think that most cities don't have that mapped out, but more and more cities are wanting to try to figure that out. And this work that I'm talking about in this the citywide study that I'm talking about, that would include mapping that out for all of your existing infrastructure plus anything I propose.
Keep in mind that whenever those lift stations were put in, right? I mean, I can speak on the ones that have been kind of put in. I better back up. That one out there on Golf Course Road, it was put in while I was here. But I mean, it was designed to go in there to service a certain area, right? And so that's what triggers those lift stations is the development. And so they have to provide engineered drawings. I didn't deal with the sewer side at the time. But they did. That's why they're placed where they are to service a certain area. Now, what we're doing now is expanding beyond what that original design was for, if that makes sense.
Yeah, and it's changed a lot. Let me give you an example. So if your lift stations were put in order, like 7 is newer than 6 and so forth, well, this is a pretty complicated system that you've got, because lift station 6, it also has 4 other lift stations that pump into it, and those are lift stations 7, 8, 9, and 12. So there's been 4 lift stations that actually pump into this lift station that we're talking about that have been built since it was originally designed. So this has been changing and evolving over the years. And I really probably believe that whoever was doing the engineering on those at the time, they probably looked at all that, and they may or may not have given that information to the city over the years. But the general practice is that at the time that all this infrastructure would have been designed and built, that information would have been known. But even amongst those service areas, things change because they're based on a plan and development, and things don't always develop it as per plan. Different things go in and that type of thing.
Because keep in mind that, that lift station that we're talking about, 6, I mean, there's, just elevation wise, and Mel can explain that better at a future date at the next meeting, but it's at a very low point, right? And so, the half of Briarwood flows to it. Those new subdivisions that are put in, they flow to it, along with other lift stations that like Mel said, they pump down into it. And so when that was originally designed and built, it may or may not have been taken into consideration, all the development that would have to be pumped and flowed into that lift station, not just the development, but the other lift stations that would go in because of development. And it's just a straight shot to that lift station.
Sure. Does it make sense though that, or not does it make sense, but just like we have lift stations that are located in areas that are developing or have the potential for development, I'm guessing we also have some lift stations that are in areas that really aren't going to see a lot of development. And I don't know that anything's pumping through them. Are we doing a capacity analysis on those lift stations as well? And if we are, how pertinent is that? Is that necessary for us to do an analysis on all lift stations, or to look at the ones that are going to be impacted by future growth?
So Mel can hit on this a little bit. And so one thing that Richard has been and one thing Richard's been really focusing on those lift stations, since he's kind of had to take charge of a lot of the collection side, is one thing that we'll get out of this as well as an efficiency standpoint, as far as, some of those pumps, as you guys know, they're in the worst environment imaginable, right? As far as corrosion and what they can take on and what they can do. And so one thing that they're doing through this is looking at the efficiency, right? And so when you look at those pumps, there's a curve for each pump. And so when we'll do drawdown tests. And so Mel and his crew will take that and they'll say, okay, these pumps are starting to wear and they're pumping way below the curve. And so what that'll do is give us additional information to see when something's starting to wear down and it's not pumping what it should. And so we can maybe have a better understanding of when something's going to wear out. Now, obviously, you guys have been a part of having to approve expenditures because certain instances have just made one blow up or lock up. Those are going to be unforeseeable. But if we can get an understanding of where they're at based off the curve and their wearing, right, we'll have a better understanding of when we're looking at possibly replacing those. I mean, do you want to expand on any of that, Mel? I know we've talked about all that, but maybe I didn't do the best job of explaining that.
I think you explained it pretty well. I'll just basically agree with you. So, and I'll just maybe say it in different words, but so we certainly could take a lift station and maybe some sewer infrastructure in an area that's developed and we don't see any future development and take that out of the study and reduce costs there. But like Sam said, when we go in and do an analysis on it, especially as old as that infrastructure is, that's likely to give us indications of wear on the system. And for example, if a pump's got a real worn impeller and it's not operating where it's supposed to be operating, you could likely reduce your power costs if we go in there and repair that pump or replace that impeller. So is that something you absolutely have to have? No, but does it provide you valuable information? Yes.
The information that we gather, can it be gathered in such a way as, so that 20 years from now, it could still be of use and of value, and to where, 20 years from now, we're not having to pay for the same type of evaluation?
Mark, let me tack on to your question if you don't mind.
Sure.
In addition to what Mark's asking, is what you're doing something that our city staff can be trained to do so that we can do monitoring on our own over time?
Certainly some of it, yes. Like doing the analysis on where the pumps are at relative to their curve and that type of thing. Yes, we could teach Sam and Richard and their staff. Some of it is, engineering work that is best left to an engineer. But as far as just keeping an eye on those pumps and figuring out where they're operating, where they should operate. Yes, and another good thing that you guys have got going is this GIS system that you guys have invested in. That is going to be a killer tool, and all this data that we're going to be collecting on the capacity and that type of thing, you guys could enter that into that GIS system and have all the information at your fingertips for years. So that's another good tool if we take this information and you can feed it into that GIS system.
Like Mark is asking though, what's the shelf life of the evaluation that you're doing?
Well, the evaluation of the existing capacity is as it stands today. It's only going to change through which your staff could monitor if we show them how to do it, and development. So as you develop, you'll every few years you could update the plan or something, but you wouldn't have to recreate it from scratch. Even if you had a different engineer in the future, let's say that I do this study for you, and 4 or 5 years from now, you're like, okay, this particular area of the city has developed, and we wonder if that's plan that Mel put together still makes sense. I'm going to give you every single thing I do, every single calculation in a big old thick report. That other engineer could take that and start with that and not have to reinvent the wheel.
Good. Any other questions for Mel on this? I'm going to give you just a moment then if the board, if anybody wants to approve the going ahead and doing the analysis on lift station 6 tonight. Is there anybody interested in that wants to make a motion on that?
Yeah, I would move that we would go ahead with at least that lift station, given the pressure on that development area.
Second.
Got a motion and a second. You got that recorded, Karen? All right, then the motion is to approve having Great Rivers move forward on the capacity analysis for lift station 6 on the work order number 5, I believe it is, that's been presented. Is there any discussion or additional questions? All right, then.
Could I ask one?
I'm sorry?
I've got one more. And Sam, you may not know the answer to this, but there, in the capacity fund, there is a little over $60,000. Do you know how many years that has, it took to accumulate to that amount?
Monica, do you have that with you? Monica's not in the building. I can get that for you. I don't know if I can get it for you tonight, but
okay. I was just curious because I mean, if we do, it's good that is there and it's not being used for anything else. But my thought would be, how quickly will that replenish itself?
That's
a great question. Yep. No, that's a great question.
You send that out after the meeting sometime, Sam, maybe tomorrow or next day?
Yep.
Okay. All right. Any other questions then? All right. All in favor by show of hand, please.
Aye.
All right. That's all yeas. Motion approved. And now the next question is there any motion to approve the city making application for the SKEEP grant as it's been presented tonight?
So I have a question.
Oh, sorry.
Oh, I beg your pardon. I just have a question about it. So that doesn't necessarily. Could the motion be to apply for this for the grant, and leaving out a determination of what we'd actually use it for? I mean, as far as determining, for example, you know, the financial plan on that, as it's presented in the scope of work, would be not just the city $10,000 match portion, but an additional portion of 29.5. So we could leave that question for later and just apply for the grant is my question.
Yes, as I understand it, because the only thing that we're committing to in the grant application, if I understand right, is, and that's if it's accepted by the city later, and Mel, you're there, so, but it's the 20% match, right?
Yeah, that's correct. We can set it up that way. And then if you just choose to, do the citywide study, then you would just add additional funds to it. So I'll make sure that we prepare the application to where you can only do a $60,000 study, and then you can always do something bigger. It's your money. So.
Yeah, because I could support it that way, since, you know, that's quite a bit more discussion than we're probably going to achieve tonight. But if it's limited to the simple question whether we do or do not apply for the grant, that I'm interested in that, certainly, but not necessarily trying to determine tonight actually how many additional dollars we would spend on and on what scope of work.
Yeah. So that is the question then: is there? I saw Vicky raise her hand, so she can nod if she agrees with this motion that the city would be approved to make application for the SKEEP grant with the $50,000 from the state, $10,000 from the city. And she says yes. Is there a second? Mark has a second. Is there any additional discussion? Mel, I just want to ask you, the way that we're doing that, does that work for you?
Yep.
Okay. Then by show of hand, all in favor? That's 100%. All right. And then Mel, thank you very much for your help and for being on here. We're going to go ahead and move on to the, unless there's anything else on that.
I think I'm fine.
Okay, then we're going to go ahead and move on to the Grow Vision 2020 update. And I believe we're primarily dealing with the website of Grow Vision 2020. And we have Steve Prangy on here. Hi, Steve.
Hey guys, can you hear me?
Yes.
So you guys had asked at I presented this. Steve had sent this agreement over to John. I don't even know, some time ago, and it just I brought it to you guys at a previous meeting, and so asking if you guys wanted to move forward with it. And so one of the questions you guys had brought up was, prior to you guys making a decision whether you wanted to do it or not, was looking into how much traffic that website is seeing. And so I reached out to Steve. I asked him to put something together on it and present it tonight. And so with that, I'll turn it over to you, Steve. Do you want that data up there now, or do you want me to tell you when you want it? Or you tell me when you want it?
Yeah, why don't you just go ahead? Can you show that PowerPoint I sent to you?
Yep.
Perfect. All right, first off, good to see everybody healthy during these crazy times, but I prepared this for Sam at his request. Go ahead, Sam, to the next page. So you currently have a website right now that is up and running called Grow Vision 2020, and included in the website are 9 different project pages. And this was established as part of the growth plan and the comp plan that Scott Hansen had been working with you all on. And Mayor, I think if you remember, we kind of kicked this off as part of the interchange project in the early days. And so it's been going for a few years now. And so just for those who aren't familiar with it, I just thought I'd have this slide to just kind of tell you what's there and what kind of information is there. So there's 9 different project pages within the site, and you can kind of click on the location within the city and get more detailed information on each project page on what's going on. So you've got one for the interchange, one for Elm Street Phase 1, one for the downtown square, the Highway C reroute, the Hubble Banning Buffalo intersection, the pool and activity center, the Elm Street Phase 2, the wastewater treatment plant, and the water system improvements. So go ahead, Sam. So then, as far as the traffic and the amount of people who've been visiting the site, I pulled the information from April of 2018 to April of 2020. And so you can kind of see the fluctuations, but the total numbers for the 2 years that it's been in service have been about 5,000 homepage. And then when you see it, it jumps to like 9,475. And so that is basically the number of visits to the individual project pages. So that's, my web people are basically telling me that the average person who visits the website is interested in 1 or 2 of the projects. So they're visiting probably for information on one project and then seeing something else that catches their eye. So that's why you're seeing kind of a double number between the people who visit the homepage and the number of visits per project page. Go ahead to the next one, Sam. So the website traffic numbers in 2019, I just broke this out, a little under 3,000 visits in 2019. And again, double the page visits. And then again, Sam, one more. And then just in the last 30 days, there's been 137 visits in March. And this page breaks this down into unique visitors, and page views. So the unique visitors is basically the count there in the black that represents people who are new to the website. So their IP address has never visited the site before. So you can kind of tell between new visitors and old visitors who are just re-clicking on it multiple times. So like an administrator like maybe Sam or somebody on staff who's visiting and monitoring the website, it's not counting them as double under that unique visitor tally. Go to the next one, Sam. And then this is a breakdown of the different types of devices that are accessing the website. So, it's kind of a 50-50 desktop and a mobile. The visits by source, Google, MoDOT, Facebook. So this is an interesting one to give MoDOT. So, only 18% of the people visiting the site are coming to them from the MoDOT page. So they may be going to MoDOT and seeing something about the I-44 interchange and then getting the link to your page. Only 18% of your visitors are doing that. The other percentages are coming from either Google or directly typing it in. I would say the one that my web people say is a big statistic here is the number of direct visitors. So you've got a following with almost 36% of the people visiting by a direct source. So they've got the page, they've got it either in their favorites on their tablet or their phone, and they're visiting the site. By browser, I don't know if that makes much of a difference there, and operating system. So next one, Sam. So tonight, the contract that's in front of you, we prepared this for John a while back. I think it was back in like October, maybe of last year. And John's request was basically, hey, we've got this existing contract commitment to keep the web page up to date for the interchange part of the website. So I want you guys to know we have money and we're currently obligated, as CMT is, to keep this website up and going for the I-44 and the CC reroute parts of the website. So anything I'm putting in front of you today is not paying double for that or paying again for that. That carries all the way through March of next year. So that's covered. And then what else? The other thing that's really covered that isn't really included in this because it's already completed in the project page is really set up already with all the details, is the completed section of the pool and activity center. So that project's completed. There's a lot of great information on that page. So we really don't have anything else to really do on that except for just kind of showcase the completed as promised, almost documentation that the city did what it was going to say it was going to do. So Sam, this is the next page, last one. So tonight, what's in front of you is the proposed contract to keep all the other project pages to date. So again, the interchange will already be kept up to date with some work to be done on keeping the downtown square project up to date, the Hubble Banning Buffalo page up to date, the Elm Street extension that is tied to the northern part of Elm Street to DC from the pool. And then we have some drone flights programmed in here because at the time, John Benson wanted me to include some additional, we have a lot of drone flights programmed into the interchange project, but he thought it might be good to also get that aerial perspective on the wastewater treatment plant, the water improvements like with the water tower going up, and then the Hubble Banning Buffalo intersection, all that kind of stuff. So he had me give a cost per flight in there, and it's kind of like an additional as needed based upon request service. So that's included in the contract. And so all of these individual project pages are kind of under construction right now. So tonight, I think, and what John's intention was to get the ball rolling on somebody being the point of contact to just maintain these, keep them up to date, get the information, like Mel's on the call right now, you know, like we would collaborate with Mel and get the information for, you know, Hubble Banning Buffalo, and we'd collaborate with MoDOT so your staff didn't have to take the time to get all those details on schedule and progress and those kinds of things. And I've got Megan, who coordinated the groundbreaking for Marshfield. I won't be doing this work. So surprise, surprise, I won't be doing this work, but Megan will. And she's a web designer, and she'll be taking over this if you guys decide to move forward. So other than that, Sam, that's really what I had to kind of present some more details that I think you were looking for. Is there anything
Yep. So I've got the, just a recap for him, right? I've got, you see up there, I put the standard agreement up that you sent forward. And so could you talk a little bit about, you know, I'm assuming that if we wanted to scale some things back, you know, I know that in the original, or in the other attachment, I didn't put it on here, but there was some things in there that were based off of per flights and per incidents, whatever it might be. And so this is I'm reading this as a not to exceed 15,000. Is that correct? And if so, I'm assuming that that's only billed as you guys do it or approved, or once this is approved, how much of that would you do? Does that make sense?
Yeah. Let me pull up that scope document. Hold on. It's not in there as page 2.
No, I don't think so. I had it.
Okay.
Hey, Sam.
Yeah.
Let me mention one other thing, just so we're clear on that, because this is listed specifically as a Grow Vision 2020 update on the agenda.
Yeah, I'm not asking for
approval. Sure that we would be able to vote on the agreement.
Yeah, I'm not asking for approval tonight.
Okay.
I would want to do, this is one of those things that could be, that it's not necessarily time sensitive. And so I wanted to get all the information to you all. And then that way, if you guys have any questions, I'm trying to get everything lined up to where you guys only have to meet when you have to meet in person.
Sure. So 2 things that I want to maybe see here pretty quick in this. One of them is, and you may have already shown this to us, but I don't have it in front of me. What is the amount that we would pay CMT, basically the base amount, for being our provider in updating the site? And then, excuse me, number 2 is, because I know we have to maintain the interchange portion of this, is there anything about this that is time sensitive?
Yeah, good question. Time sensitive, no. The interchanges and our obligations to MoDOT to keep that up to date are being fulfilled as part of the interchange contract. So we're good there. Unless the board had one of these projects that they thought it was pretty mission critical to get information out to the public on. But right now, Mayor, on the interchange, nothing time sensitive.
Okay.
On CMT's obligations, I think, Sam, I think the contract you have up on the screen, it says not lump sum, but it says a on time and expense based occurrence contract. So to answer your question, yeah, I mean, all of these flights and everything would be at your request, and then at the menu cost that we provided per occurrence that you guys wanted to do that, and then the hourly rates would be at the hourly rates shown in attachment. Yep.
And so it literally is a, you know, at the end of it, it's a not to exceed the 15,000 for services.
Okay.
Yeah.
Right. John wanted a total budget amount that he could take back to Grove Marshfield so that they could, you know, decide that they had a cap at least, so he knew. And so I said, well, to get this through, you know, the next question might be, how far does this take us through? I mean, what this would do would get everything up to date and get everything done so that it would take you through December, I think, of 2021.
Services provided from February 2020 to June of 2021.
June 2021, yeah. And I think that was at the time based on the completion dates for most of these projects. But if that slides, yeah. Thanks, Mayor.
Yeah, no, that's fine. And just to bring it to a simple question that we can't actually answer tonight is, and I want to make sure I'm saying this right. The website is going to be it's going to exist no matter what, because it has to, in order to facilitate our project on the interchange and our agreement with MoDOT. Mm-hmm. So the interchange portion of Grow Vision 2020 is going to be up and running and exist. What we're looking at is the updates on the various other projects that we have out there, and what's going on with those projects. So what's probably happening when you look at the statistics that you're showing is a lot of people are going to look at the interchange. And then, and at one time that may have been the pool, but the pool is done now. So they're looking at the interchange, and then they're clicking on and looking at something else that's going on in the city. And a lot of that has to do with how much we're actually promoting it and getting it out there. And we haven't really been doing that for a few months. So we're going to see our numbers start to fall off on that a little bit, as when you look at those numbers that you're showing, that's what's happening. But the more we get it out there and the more we promote it and tell people it's there, the more they're going to use it. So in order to keep it updated on all the areas other than the interchange, which will be done no matter what, we're looking at approving up to $15,000 to do that through June of 2021. And in addition to that, if we want to do additional drone flyovers, things like that, there is I believe there is an additional fee based on per service, right? For those types of things.
Yep, and that's included in the $15,000.
That would be included in the cap. Okay, gotcha. Is there anything? Am I saying that right?
Yep.
Okay. All right. Super.
Hey, Steve, if I'm assuming if the board doesn't want to push forward and doesn't want to update those other projects, I'm assuming that's something that, if we're not going to keep current information in there, that's something that can be pulled off the website, correct? As a drop down menu.
Yep, we can pull them. We can pull them from the drop down, or we could just, right now, the way they are is they just have an under construction.
Yeah.
Error on them. You know, when you go to a website, it just says under construction. When you go to some of those pages, it shows that error. So if you guys elect to just pull them, then we could definitely do that.
I mean, if we weren't going to do it, then it might make sense to do that so that it wasn't, you know, so we don't have something up there that we're not updating.
Yep.
Are any of these dollars budgeted?
Not that
Right, so
I'm,
then
not
when
that
it comes
I'm
back
aware
to
of.
the board, when it comes back to the board, knowing where the dollars would come from, and back to the question we always ask, right? Is it a new expenditure that we're looking at, or is there any way to offset it? We'd want to be able to answer those questions. We don't have to answer them tonight. When it comes back to the board for approval, though, that will be something we'll want to look into.
Yeah, I can tell you tonight that it's not budgeted. Monica, you chime in here, right? But it's not budgeted. But I was only when Steve sent this over to me. Well, as soon as he got it to me, I got it right to you, and that was the first I'd seen of it. So I don't know if Monica had seen it, but I hadn't seen any of it during the budget process.
Sure, but we would want to know how the expenditure would be allocated across all the different departments and what impact it would have on the general operating fund.
Yeah, so Monica and I have talked about that, right? And so basically we'll bring something back to you, but we have had that conversation already. Basically, looking at it, we're talking about 3 different projects, but probably they're not all equal in scale and how much work's going to go into them, right? I mean, when you talk about the water line expansion, there's not going to be a whole lot to add to that. Now, when you start talking about, other aspects of it and drone footage of this and that, it could be a percentage base. And so Monica, I'll put something together on that and we'll bring that back to you for your guys' consideration, whether you move forward or not.
Okay. And realistically, for me, it's even more simple than that. If we've got 7 projects listed on there, 5 of them that are not interchange, then look at the funds that are funding those 5 and split it in 5 ways. And so,
right. I think there's 2 options, right? I think there's a percentage base, and then I think there's a project based, right? I mean, split it up between however many projects are involved. So
yeah, okay, super. Steve, thank you very much. Appreciate you sticking in here on our virtual meeting. Looks.
I just want to leave everybody on a happy note. The wind's picking up here in Springfield, so all be safe. I hope we're all in a better place next time I see you.
All right.
Thank you very much, and you be safe as well.
Thanks, Steve.
All right. So let's move to the basically the last part of our meeting here, the 2020 pool opening and agreement with Westport Pools. We have a bill on this, but Mark is going to talk about it here for a few moments, and then we'll discuss the bill.
There you go. Are you with us, Mark?
I'm unmuted.
There you go.
Let's see. We're talking about the 2020 pool opening and closing contract. We talked about this extensively in the fall when it came to closing time, and had several other companies come out and look at the pool and things like that. And we settled on Westport Pools. They are the company who installed and put in the pool and are very familiar with that. They are also the company that winterized it fall of 2019. And it's just time to get that contract signed so that we can schedule a date for them to come and de-winterize the pool and get it ready to open with all the pumps running and water in the pool and chemical balances, etc.
So my first question is it a little premature to start setting a date for opening the pool given our current circumstances?
Yes, I believe so. This contract will allow us to set a date when that time comes. So we don't have to set a specific date right now, but this will allow us to set a date at which point we're at a point where we can all agree that that's something that we want to do this summer.
And it also allows us to back out of it if, this is a no-go without any penalty, correct? That's what I read?
Yes, sir. In fact, I had them add that language. So even if we enter into a date, which we don't have to schedule upon the time that we send that contract in, We can do it as we get closer to time and we know that we're going to open. But even if we set that date, if we give them 7 days notice, we can back out of that with no penalty and move that date to a future date.
So Mark, what then is the value of entering into a contract agreement now? What do we gain by doing that?
Just the ability to, I think, move the process quicker. If we're on a timeline that's truncated and, they're busy, we've already got that contract in place, and we don't have to set a date at all if we're not going to open our pool.
And Westport Pools had basically, in the conversations that Mark and I had with them too, they had basically said, they're just trying to get their work schedule figured out, their tentative work schedule figured out, just kind of like what we are. And so it's reserving us a spot if we come up and we need it.
So I want to sort of maybe try to understand how that's actually possible as far as reserving a spot when we don't know when it would be. I mean, I for myself, I really question entering a contract until we know we want services. And right now, I mean, I hate to say it, but it's a reality we have to face is we don't know if we will need this year or not. I certainly hope so, but we don't know. And so I don't know if the mayor's comments sort of fairly lead to believe maybe we don't need to do this until we know we need to do it. We're going to have to be together to make that decision as a board anyway. At that point, we could decide to go into contract. And I don't think that would be a unique position for most municipalities at this point.
Yeah, the only thing that I see about it, and what I'm trying to get at, is by entering into an agreement now, do we gain any leverage on setting our opening date down the road? Maybe we don't want to do it anyway, but that's what I'm asking, because if we don't, then we're entering into an agreement that we don't know if we're going to use. Number one, we don't gain any leverage for setting our opening date, number two, and we can exit out of the agreement anytime we want to, number three. So what's the point of an agreement at that?
I'm with you. I'm hearing what you're saying. I just, it was just timing as far as I was concerned, and the timeline. If we need to get together quick and we can come together, quickly to get something done at that point, I'm fine with leaving it undone.
I would say that we're going to know, I think you would agree. I hear what you're saying, and that's good. We got it in front of the board. We're going to know weeks ahead of when we're going to open our pool. Wouldn't you agree?
We'll have to, because of, programming and getting those final things ready to go and staff training and things like that. Absolutely.
Okay. So my question is, if we enter into an agreement now, if we know weeks ahead of when we're going to open our pool, is there really any value in not waiting and just entering into an agreement at that time?
You make a great point.
I don't now versus that.
I don't think so.
Okay.
Sam.
What's your thought, Sam?
No, I agree. Just one of those things we wanted to get out in front of the board. And
Sure.
So, it is one of those things that if it was time sensitive, we could do that under a meeting just like this if we needed to. And so it could be pretty short and simple. It was, like Mark said, it was budgeted. It just exceeds my purchasing authority.
Right.
And so, I think we could do it anytime.
Okay.
Is it possible if we do wait that, there's plenty of other pools in the area that are, everyone's in the same boat we are, but that they could get backlogged and wouldn't be able to open the pool for us because they're occupied?
Because they got a contract before we did.
Yeah, I don't know. I don't know. We're so much in uncharted territory. That's a great question, Mark, and I don't know that that right there was the only reason that when Mark and I were talking is why we kind of wanted to get it out in front of the board, was because, you know, it could be argued from our end that, hey, we want you to push us, you know, even if when we weren't sure, we wanted to get the contract signed. And so that was really the big push on our end.
I think the only way to know if that's even going to be a possibility that we would have some sort of preference or not is if the contract, by signing the contract early, it actually came with a guarantee that, okay, you have this place in line. You are this number on our installation schedule. And short of that, it's whatever they choose to do, whatever order, I would think.
Yeah,
I agree.
Short of having leverage on the date, I mean, there would be no reason to enter into the agreement right now.
Exactly.
Agree.
That's kind of where I am. Unless there's more information that says this is specifically the value of doing this without even knowing if you're going to open your pool this year.
yeah, I don't disagree
It's
with
not
any
in
of
the
that.
contract.
Yep.
Okay, all right. And possibly not even necessary, really. I mean, we're going to know far enough in advance on the opening of our pool, and we're going to schedule it not only with when we want to open it, but when we can have it opened up by Westport Pools. So, really, it probably is a non-issue.
No, I don't disagree. And so with that, right, it doesn't sound like we're going to need the ordinance, but I will have Mark, I talked to him this week. Hey, Mark, did you go ahead and finish up? You want to give him an update on from Vortex?
I do. Something kind of scary happened this week. Keith McGregor was the person from Vortex that was heading up the project that came down and oversaw the disassembly and the shipping of the parts to North Carolina to be repowder coated. He is no longer with Vortex. Westport Pools Representative Jason Hill has really been constant in keeping touch with Vortex and kind of prodding them and prompting them to continue to give us updates. And he sent out a couple of emails and didn't get a response. And then Keith McGregor responded back and said he was no longer with the company. And I was kind of concerned given Vortex's track record of communication, but they had several people get back in touch with us. And we also have an email from the new project manager. His name is Sean Garner, and he has tracked down the metal materials that were shipped off to North Carolina for powder coating. And he has verified that we are still on track for them to get started out there by April 20th.
Okay. Good. So everything's on schedule as far as having the unit there so that when we are ready to open, the playset will be ready and part of our operation.
That is correct.
Okay, good. All right. Well, listen, we are in uncharted territory, right? This is we need to continue to think about, pray about, with our community. Things seem to be going okay, but you know, it's a difficult time for people, and so let's remember that. Our next meeting will be as normal. It'll be the next. What date's it on? The
23rd.
23rd,
April
and it will be in the council room. We'll see where we're at that time. We were thinking if we continue in this mode, we'll try to, if we have to have 2 meetings a month, we'll try to limit one to a meeting like this, and then if we have to get together, it will be if we have to deal with something like a bond issue or something with that type of weight. Otherwise, we'll try to do a virtual meeting as long as we're allowed to. So is everybody okay with that?
I will throw out there, Robert, that you know, we talked about it. If when we need to get together, even possibly the next meeting, with the COVID-19 projected peak time being around that time, you know, we the meeting may not be here at City Hall. We may look at going to the safe room. We may look at, something that will expand in a much larger area. If the weather holds out, we can set something up outside at the fire station or something like that. We can do something to keep our social distancing. So
We'll do everything that we can in order to keep the social distancing and keep everybody safe. If we can at all, we will do a virtual meeting if everybody is in agreement and doesn't have any issues with this type of meeting right now. And I'm just looking for the board members. Is there anything about this type of meeting that you would have an issue with?
No.
This went
Absolutely
great.
not.
Okay.
No, for me, before we leave this meeting, I wanted to ask something, and I guess I didn't know if it would. I waited to see if it would come up when Mark was presenting, but I see that's pretty limited to pool. But under COVID-19 topic, have we canceled any of the city sports that we were planning on doing? For example, soccer. Has been a call on some of those that's beyond wait and see? Now we've canceled.
My knowledge, and Mark will answer it in detail, but at this point, we've not made a decision to actually cancel.
Okay, follow-up question to that.
That's going to be a decision that's going to come up, though.
Yeah, I would think pretty soon. Yeah. So follow-up question to that, not necessarily for this meeting, but just so that it could be information that could get to us. Once we get so far past the original schedule on that, I want to be sure that, and maybe it's already the plan, but I want to make sure that those who wish to, not participate after being postponed, that they don't. There's no question that they can get a refund.
Refund, sure.
And if that policy's already started, or if it needs to be on a future agenda item, so that we can just make sure that we need to be as hassle-free to deal with as possible, so that people have a good vibe from us from this point forward, from however far back. But we just don't want to. We just want to be as friendly as possible, especially during these times, with no question, no hassle on refunds for anybody that asks for it.
Absolutely.
Yeah, there's not going to be any obstacles in the way of doing refunds. There's no doubt about that. We just haven't, and again, I'll let Mark speak if he wants to on this, but we just haven't, we're like everybody else, right? We're hoping that things are going to pass over in a matter of a couple of weeks and that we're going to be able pretty quick to move on, but it's looking more and more like that's not the case. And so,
yeah.
So I get that 100%, and I like the optimism, because there are a lot of people that do want to do it. But I'm just saying, if it suddenly isn't at this point, has it already been delayed? I'm not even aware.
It has been delayed.
Okay, so what I want to make sure is even short of us saying, okay, we're not going to do it, I think already at this point, if there are people who now it doesn't jive with their schedule because of what they had scheduled afterwards, I want to make sure that if you need authorization to already refund money for those that cannot or choose not to participate, I want to make sure there's no barrier even now, because we've had delays.
Have we had requests for refunds?
We have had 2 requests for refunds. One was due to a scheduling issue, I believe, and another was due to the fact that someone had lost their job and wouldn't be able to participate at that point.
Have we provided the refund?
I've given those to Monica. I don't know if the checks have been cut yet.
Okay, so 2 requests, and we have given the refund. I see Monica nodding.
So fair to say, if anybody asks for a refund, generally it's happening already.
Yes, sir.
Yes.
Okay, that's great.
And we'll be.
I think that's important for everybody to feel good about not worrying about dealing with the city.
And we'll be tracking those as well, because that will be one of the things that we look at, and that we'll most definitely be trying to maybe seek help or reimbursement monies for COVID-19. And so because that'll impact the revenue, right? And so we'll track those refunds and track that as part of a loss of revenue or something dealing with COVID-19 that maybe we can put in there.
Okay.
Unfortunately, we do need to make a decision on cancellation and get that information out fairly quick, because we're at that point where I think that we've seen enough people asking the question, are you going to cancel the season? Are you going to do whatever? That we need to be able to provide an answer for that. So.
And Mark and I've talked a little bit, and so I would think that you know, we'll be coming up probably next week at some point. Park committee has not met via Zoom. We have talked about that a little bit, and so it'd be a perfect time to bring that up with them and kind of get all input and run this through that process as well.
Okay. All right. All that said, is there a motion to adjourn?
So moved.
Motion and a second. I guess you got that, Karen. All in favor by raise of hand? All right. Meeting adjourned. Thank you, Dwayne, for plugging in, and Karen and Tammy and Rick and Natalie and everybody else that I can actually see. So we'll talk to you in a couple of weeks.
Thank you.
Thanks a lot.